Social interaction has really helped me in a lot of situations, but particularly one that I am thinking of is my first trip in for chemotherapy, which was incredibly challenging and nerve-wracking. And as I was getting set up in my infusion room with the nurse, she had such direct and kind interaction with me and was talking to me. She's getting my IV in, she's setting up my meds on the pole, getting me everything I need, and talking to me the whole time and responding to me, and we're having a conversation. And that alone put me at ease in a way that was incredibly welcome. But even more, she revealed that she was just recovering from cervical cancer herself and had been through treatment and surgery. And the fact that she shared that with me and connected with me on that level gave me the strength I needed to get through that first treatment and many others after, and it made an incredible difference.
The medical profession is a very social field. We are talking with patients day in and day out. We're not only talking with patients, but we're talking to a whole variety of different health professionals, as well as outside mediators to help bring about healthcare. What does that balloon look like? Does it look angry?
It looks like it's about to pop.
As an instructor, how I try to improve social interaction between myself and the students is that I generally like to ask a lot of open-ended questions. And I also like to ask and go up to each and every single student and ask them a question, whether they be right, whether they be wrong. All I ask is for them to try to answer something. And it works. A lot of students get more comfortable, and they're allowed, they feel that at ease to elaborate on various things, whether they're right or they're wrong.
Interacting with other patients, with the other staff members is very important. The patients seem to like it when you know their name and you joke around with them to try to make it a better experience for them while they're here in the office, because they're coming to the doctor's office sometimes they're not feeling well, but you try to make them feel better while they're here and make them feel comfortable.
I think the key elements of successful social interaction within the workplace is understanding that there are certain things you need to keep out of the workplace. We work in a very professional environment where we're dealing with people's health, and what you do outside of work is your business, but it may not always mesh with what we do. Teamwork is very important within the office. My medical assistants, they all need to work together. Generally, once you get to know a patient, you can bring a patient in, you know what needs to be done before the doctor or the nurse is going to see them. By working together, a good MA can say, okay, I'll go draw the blood, I'll go do the requisition, you take them to the bathroom, do urine tests, whatever we need. By working together, you can get that patient in quick. There's no waiting time. The doctor can come out, he's ready to go. Vitals are already taken, they're put into the EMR. Doctor can go in, do what he does, patient can go. This way, you're not waiting. The idea is we don't want the patient to wait. There's always things that the MAs can do if they work together before the doctor gets there. Doctor gets in, everything's taken care of, he's happy, the patient's happy, the MA's happy. Teamwork.